Hello, I'm Paul Room and I work as a GP in Kent. This video is designed to be a useful learning tool for GPs to help you recognise and spot the common signs of cardiomyopathy. We'll demonstrate the common symptoms, what other conditions they may appear to be, and guide you through the right questions to ask. This film consists of 3 different patients, each visiting their doctor with common symptoms. You'll be guided through the recognition and diagnosis process and then given information on next steps, including key referral triggers and who it is appropriate to refer to. Aaron is a young man in his early 20s who used to be quite sporty, but is finding that increasingly he is unable to take part in sport. He presents to his GP with breathlessness and fatigue.
How can I help today?
Yeah, lately I've been feeling really breathless and tired. I'm not doing as much running as well as what I was. So my girlfriend encouraged me to come down to see you. Also my friends have started noticing I'm getting really tired as well.
So tell me about the breathlessness then, first of all. When's that happening?
Just general, like when I'm at home, just sitting around, or when I'm just moving around the house, it happens. A couple of times I've woke up, felt really out of breath. I've thought about calling the doctors out as well.
The key points to establish here are: is the breathlessness at rest or after exertion, and is it affected by posture? Is the patient expectorating or coughing? And has the patient gained any weight recently?
And what about the tiredness? What's happening with that?
Just getting around the house, I feel it the most. I've actually phoned in sick as well because I'm feeling that tired, which I've never done before.
The key points to consider here are: is the fatigue related to an unusual activity? Is it interfering with the activities of daily living? Is it worsening?
And otherwise, do you smoke at all?
I don't smoke. I drink occasionally at the weekends with my friends, but I haven't really been going out either, just where I've been feeling like tired.
There are other secondary symptoms to also consider. For example, weight gain and swelling in the ankles and abdomen that may indicate fluid retention. Has the patient experienced any palpitations?
What about in the family? Is there anything that tends to run in the family at all that you're aware of?
No, not that I know of, no.
Once you have established that the patient is breathless and tired, then taking a family history is the next step. There are 5 key questions to ask that may prompt the patient, especially if they are unsure. It takes 2 minutes and gives a detailed family history, so it is quick to do and is a vital part of the diagnosis.
Is it all right if I ask a few more specific questions about the family?
Yeah, of course, yeah.
Are both your parents still alive?
They are, yeah.
Okay. Is there anyone in the family that died unexpectedly, particularly sort of below the age of 45 at all?
Yeah, my uncle did, but I was only little, so I don't really know what it was.
Are your parents both alive? Have there been any unexplained sudden deaths in family members under the age of 45? Have there been any cot deaths? Have there been any unexplained drownings or car accidents? Does anyone in your family have a pacemaker, or are they being treated for heart rhythm problems such as atrial fibrillation?
Sounds as if it might be something to do with your heart. I thought we need to do some blood tests and an ECG. We do a recording of the heart rate in the surgery here, and then refer you on to a cardiologist, a heart doctor, if that's okay with you. Does that sound
Yeah, that's
okay?
fine. Yeah, thank you.
Okay,
Cheers.
all right.
Aaron is showing symptoms associated with a cardiomyopathy. There is evidence that this may be genetic in nature as well. Patients such as this should be referred to a cardiologist for their evaluation. Tests such as ECG, chest X-ray, blood tests, 24-hour ECG and echocardiogram can be arranged at the time of referral. If it does turn out that he has a cardiomyopathy, then his first-degree relatives should be offered screening as well. There are indicators with this patient that you should refer on to a cardiologist. Say what you see. This patient is presenting with an evolving history of breathlessness at rest and significant fatigue. there is evidence of a genetic link with a suggested family history of sudden death or heart failure type condition. Breathlessness can often be linked to asthma, but in this case it would not be correct. The family history is so important here as it indicates cardiac issues to investigate further. Eddie is in his early 50s and he presents with a history of syncope and near syncope and some pains in his chest. He is otherwise quite fit but not overly active.
How can I help?
Come to see you today because I've got, it seems to me to be increasing dizzy spells, and fairly recently I did actually sort of pass out for a couple of seconds.
Okay, so the dizziness and the fainting, what's been happening with that then? How long has that been?
Well, it can happen at any time. Sometimes when I'm sitting down in a chair watching television, say, I can feel it, my heart will start racing, and then I'll get a bit sweaty, and then I'll feel a bit faint, and there's a bit of a sort of an ache across the chest, and that's when I get a bit dizzy.
GPs often see patients who have lost consciousness for a period of time. To distinguish between cardiomyopathy and other causes, such as vasovagal faint or a neurological cause, you should consider several key points. Is this an early sign of seizures? Could there be a neurological cause? There is often a common misdiagnosis of neurological problems linked to syncope, so it's important to investigate further as this can be cardiac in nature, which is why the family history is so important. The distinguishing feature here is the palpitations that the patient is experiencing. It doesn't seem postural as the patient has felt faint while sitting down, but you could also consider low blood pressure.
And how long are the episodes sort of lasting for then when you get to them?
They can go up to about 10 minutes.
Right, okay. And you said you actually fainted or lost consciousness?
Yeah,
for
a couple of weeks ago I did actually pass out for a couple of seconds.
And you said about an ache in the chest. Tell me about that a little bit.
It's not a pain, it's just an ache across the chest, across the whole of the chest.
Yeah. And is that if you're doing anything in particular? Or...
No, not really. It's, as I say, it can happen when I'm sitting in a chair or just I'm walking normally outside.
Distinguishing the type of pain the patient is feeling and when they are experiencing it is key. With chest pain, it is necessary to exclude coronary artery disease, but patients with cardiomyopathy can have chest pain as well. The mechanism of this pain is unclear. The key points here are the pain is more pronounced after activity, but the patient still experiences it at rest. The palpitations are also connected symptoms, and the pain is different to angina-type pain. Cardiomyopathies may give an abnormal ECG, but a normal ECG doesn't rule out a cardiomyopathy.
Anyone in the family that's had a problem, sort of an unexpected death, died suddenly, say from a drowning or a car accident, something you weren't aware of?
No, nothing like that, but we had a sister that some years ago died quite young, and I'm not quite sure what it was.
What about anyone in the family who's got a pacemaker or a heart rhythm problem?
Oh, no, you mentioned a pacemaker. I did have a brother. I still have a brother.
Yeah.
I'm sure he had a pacemaker fitted some years ago.
Eddie's family history is a key indicator here, and teasing the information out with our 5 questions does this quickly and effectively and shows other possible areas to explore.
Otherwise, any other problems feel fit and well apart from this?
Yeah, feel good otherwise. Apart from that, that's the only thing really that I can think of. Everything else is I'm pretty okay really. It's just these sort of dizzy spells that are beginning to worry me.
Yeah, certainly. I mean, it certainly does sort of sound as if it could be something to do with your heart. So I think we need to do some sort of blood tests and an ECG, some basic investigations in the surgery, and then refer you on to a cardiologist, a heart doctor, to to look at things further.
Okay, so you think it might be something to do with the heart then?
Yeah, it
Yes.
certainly sort of sounds like that's what we need to look at and so
Okay.
rule out some things.
Eddie is showing symptoms of a type of cardiomyopathy. It is highly likely his symptoms are cardiac in origin. It is therefore appropriate to refer him to a cardiologist. Because of his family history, once he has seen the cardiologist, he may be referred further on to a specialist in genetic cardiac conditions. If diagnosed, his first-degree relatives will also need referring to a cardiologist for screening. The key indicators here are the patient is experiencing unexplained syncope with palpitations and chest pains. There's a family history of first-degree relatives suffering unexplained sudden death and having a pacemaker implanted. Emma is in her late 20s and has been experiencing palpitations and bouts of dizziness.
Morning, Emma. How can I help?
Well, basically, I've been having this problem for a while now. My heart rate just feels really funny and it just keeps beating really fast. And then sometimes it feels as though it's kind of skipped a beat.
Okay. Is this happening if you're doing anything in particular?
Not really. It seems to be all over the place. Like I was sitting in a coffee shop the other day, just having a coffee, and all of a sudden my heart started beating really fast and I got really dizzy and had to grab some tap water. And then other times it would be when I've kind of come out of swimming or come out of the gym. But I've always kind of gone to the gym and swimming, so I don't understand why this is happening. It's not painful, but it's not a nice sensation.
Feeling quite dizzy with it as well?
Yeah, and
times.
I've been feeling really faint as well.
It appears that Emma is having some form of arrhythmia. It is important to establish what type of arrhythmia and the possible causes. It is interesting to note that it is associated with exercise. Key points to consider are: have the palpitations been caused by activity, and what has the patient been doing? Are the changes postural? How long do the palpitations last for? How does the patient feel during the palpitations? Do they feel faint or have they passed out?
Is it okay to ask a bit more specific questions about your
Yeah,
family?
yeah, sure.
So, are both your parents still alive?
Yeah.
Well, what about in the family? Is there anything that runs in the family at all?
Actually, my cousin died, sadly, quite recently, and he was playing football.
Right.
And he was kind of just playing friendly football and he'd passed out and he died.
What about anything sort of unexpected? Anyone who's died through drowning or car accident, anything like that?
My auntie died. That was quite a few years ago. And it was quite suddenly because she drowned.
Emma is showing possible symptoms of a cardiomyopathy, so a referral to a cardiologist is appropriate. The key diagnosis points here are clues in the family tree. A relative died suddenly during high exertional activity. Palpitations. Dizziness not caused by postural changes. All of our patients have exhibited symptoms of a potential heart condition that warrant referral to a cardiologist for further evaluation. There are key points to consider for referral onwards. A family history that gives clues of cardiac incidents and symptoms that aren't explained by lifestyle or activities. There are further resources available to support your patients, including other videos, the website which has booklets available for download on the main types of cardiomyopathy. They can also send you any of these resources as needed and provide information and support to you and your patients.